You've been to your orthopedic doctor, they sent you to an MRI, and they confirmed you had a torn ACL. So what's next? The doctor will most likely recommend a month of physical therapy. So basically you have to get walking again, mostly normally, before you even have a surgery once you tear your ACL. It's believed if you do pre-op physical therapy, then your post-op physical therapy will be easier. So once you're strong enough, you head back to the doctor. Then the doctor will tell you your options for surgery. You could use a hamstring, a patella tendon, or a cadaver. They usually recommend hamstrings for younger people and cadavers for older people. I chose to do hamstring. I felt more comfortable using the hamstring rather than the cadaver, which were my two options. And I knew that the hamstring would be accepted back into my body because it came from my body. Also, before you're doing the physical therapy, I suggest asking your doctor if you could possibly schedule out your surgery, because after I did physical therapy for a month, then I went and I saw my doctor and I had to wait another month to have surgery because that was the next available appointment. Going into surgery, I didn't know exactly what to expect. I've never had any major surgery before. This was my first major surgery. It's pretty simple. You go in there, you lay in a bed, they put an IV in you. You wait there a little while. They check you out. If your leg's not shaven, if you got a lot of hair, then they have to get to and cut you open. They shave that part of the leg. The night before, they recommend that you wash your body with chlorhexidine to prevent infections. So I got this from CVS, antiseptic cleanser. Worked well, I'm still here. Then they ask you if you want a block in your leg, which basically puts the nerves to sleep on your leg. I said yes to that, made sense to me. Then they wheeled me down to another room. They stuck a needle in a couple times to do the block on the leg. Your leg kind of like convulses, kind of like if you took a fish out of water, stops flopping around. They'll give you a bunch of drugs to numb the pain and ignore any pain that's occurring. Then they wheel you into the surgery room, put you on a table to strap you down, start doing surgery, and then they'll also give you anesthesia, and they'll probably not tell you they're giving you anesthesia. They'll probably say something else to distract you and ask you some questions to see if you're still coherent, and then you're out. A key thing to know, if this is your first surgery and the doctor's asking if you've had anesthesia before, you might want to say it makes you nauseous, because it certainly did for me. And I know for a lot of other people, they get very nauseous from the anesthesia and maybe some of the other drugs and pain as well that you're going through, because I mean, you're having surgery, they're ripping you apart and putting you back together. So check with family members if they ever had surgery before and see if they got nauseous off the anesthesia, because you definitely want to tell your doctor that, to prepare yourself the best you can for when you wake up from surgery and you feel super sick. When I woke up from surgery, I felt a lot of pain, of course, in the knee, and then on top of that you feel super nauseous, or I felt super nauseous. Surgery takes around like a couple hours, like 3 hours probably. For me it went a little longer. I think it went around like 6 hours, because I had 2 hamstrings removed instead of 1, because one hamstring wasn't strong enough to replace my tendon. Make sure you have someone driving you to the doctor and helping you get back, because you're going to be sick, you're going to be in pain, you're not going to be able to move your leg. It's not a fun experience. So after you sit there for a little while, I don't know if it was half hour or an hour, and then they come and get you, then put you in a wheelchair and wheel you out of the hospital, and so have whoever brought you help you into the car. Then they give you some pain pills. They gave me oxycodone. You're going to take those for a couple days, and then you're going to want to switch to Advil, something a little lighter. I mean, you can do what you want, but less pain pills the better. I think the oxycodone was actually making me a little sick as well. It was hard to, figure out between was the oxycodone, or was it the pain, or was it still the anesthesia for the first couple days. Also with the block for the first couple days, they say 24 to 48 hours can't move your leg. I don't know. I couldn't move my 4 days, so tried to do the recommended exercises, tried to lift my head, and my leg was not lifting. So, when you get out of the doctor, you have a brace to keep your leg straight. They tell you to sleep with a brace on. It's not the most comfortable thing in the world, but it is what it is. Also, after you have surgery, it'll be very difficult to get in and out of the shower, so I recommend getting a shower seat. This way you can sit down on the seat and then slide into the shower and then take your shower. Also, after a couple of days, you need to take your gauze pads off. So you need to get into the shower, take your time and peel them off while the water's running on them. It'll be a lot easier with the water on them. There'll be a little blood on each gauze pad. Just take your time and then eventually they'll come off. You might get an ice machine like this. Basically put in some ice and some water, or some frozen water bottles and some water, and then you attach this hose to this little pad here, and then you put it on your leg, and then it's like a ongoing ice pack. You can just leave that on your leg and get the swelling down. So now a couple days have passed and you can probably move your leg a little bit. It's time to start doing those physical therapy exercises at home right away. Definitely keep icing, stay on your pain pills, because the first week your leg is in a bunch of pain. The key thing that I didn't know about or really think about after I had my surgery was the fact that I had to get my leg flat, because in my pre-op I didn't have to really worry about getting my leg flat. It was more just being able to bend it and then walk normally. But it is so important to get your leg flat, straight, whatever. They recommend you do quad sets. Definitely do these. Do not skip these, because you will be having problems getting your leg straight afterwards if you do not. I recommend sitting on the couch and putting your legs up, putting the recliner back, and putting a couple pillows under your ankle. This is super important. You want to do those quad sets. You want to stretch your leg out and let it hang. So you don't want the pillow like under your calf. You want it like under your ankle, so that your knee is actually hanging down, and so it can actually flatten out. It'll be painful, most definitely, but definitely advise of doing it right away. I didn't focus on that because I was thinking that mostly I needed to just like bend my knee back the other way. I didn't like think about that I had to get it like perfectly flat, and that would be like a difficult thing, but it certainly is. After about 2 weeks, you go back to the doctor. They'll check your leg out. They will probably remove your stitches, and then they will give you your new ACL brace. This brace is essentially to make sure that your knee doesn't buckle. This is my ACL brace. As you can see, you can bend it forward, but you can't bend it the other way, keeping your knee from buckling the other way. Also, ask your doctor questions. When you see him again, ask him what exactly was done to your leg. Because I wasn't sure exactly what they did to the leg. All I knew was they were using hamstrings. So next time I went to the doctor, I asked him what exactly happened during surgery, like what did he do to my leg? And so essentially he screwed in a bioabsorbable screw, and then he attached the hamstring, threaded it through, and then attached it to the button. A bioabsorbable screw is a calcium screw. I looked it up online. I guess it dissolves in 3 months. I highly recommend taking leave or working from home or whatever you can to stay home and just put your leg up and rest and do your exercises the first week, or the first 2 weeks even. You'll be on crutches, it'll be hard to get around. So hopefully after you do some leg raises, up, down, left, right, all different leg raises, and then walk around with your crutches, that you'll be able to, if your leg is straight, be able to walk in a couple weeks. For me and for many others, I had a lot of swelling and it was really hard to get down, and so I definitely recommend just like putting your leg up like 45 degrees and then putting the ice on it as much as possible. After 6 weeks, I went to my doctor, and my doctor said that my leg wasn't flat. So I went to physical therapy and told them to do whatever it takes to get my leg flat. They told me, don't worry about leg raises or anything like that right now. We need to focus on getting your leg flat. My physical therapist recommended doing 100 quad sets a day. So I did 100 quad sets a day with a pillow under my ankle and 8 pounds above my knee. Eventually, after 2 weeks of letting it hang there and hang down, my leg flattened out. My leg was still a couple degrees off, but after a couple weeks after, it flattened out the rest of the way. But even so, being only slightly off, I could start walking again, which was huge. Once you can walk, the next step is partial squats and walking exercises. You will need to learn how to walk again, as you might be swinging your leg through instead of bending your knee when you move your leg forward. You will also practice going up the stairs, as it's easier to start practicing going up the stairs than it is going down the stairs. Much easier. So after a couple weeks of strengthening, you'll go back to your doctor and your doctor will assess you. At this point, you'll probably be able to ditch the ACL brace, which is a good thing because the brace is quite long and quite awkward to have on you sometimes. It's hard to get under your pants, so I recommend some stretchy pants because they recommend to put this under your pants before it doesn't slip. It's also so tall, it gets right next to your junk, which is kind of uncomfortable as well. And then any tall boots, you're not going to be able to use those really with this either. So congratulations, at this point you can walk mostly normally, but there's still a long way to go to get back to running and playing sports and everything that you want to do without having the risk of tearing your ACL again. My doctor recommended after 4 months I'll be able to run. You may feel like after 6 to 7 months you are able to do sports again, but it's not the best of ideas. I know a lot of people who tried sports after 7 months of this surgery and they retore their ACL again, so I wouldn't recommend it unless you want to go through surgery again and then months of physical therapy again. I'm still on this journey myself. Hopefully after 4 months I'll be able to run again safely, and most doctors recommend after a year then you can start doing your sports again. If you found this video helpful, please give it a like. If you want more tips on dealing with your torn ACL, or you just want to follow my journey, please subscribe to the channel. So if you're going through ACL surgery, or if you've had ACL surgery before, please leave a comment below. I'd love to hear from other people's experiences. Thank you for watching. I hope that I have helped you in some way.